Record. Welcome to the May 6th Sacramento County Public Health Media Briefing. I will go ahead and throw it over to Dr. Olivia Casirier.
Good morning, everyone, and thank you again for joining us. So I will start with a brief update, and then additional team members will provide updates on different topics. So according to, sorry, let me get rid of this. My apologies. According to the update from yesterday morning, we are at 103,595 cases of COVID-19 reported to Sacramento County and 1,667 deaths. We are averaging a little over 100 cases per day, and the case rate, according to the blueprint, is 7.5 per 100,000. So we have dropped from 9 per 100,000 from a few weeks ago. So we are progressing slowly in the right direction. We still have hope that we will get to the orange tier before June 15th, but we would have to see a continuation of the trend downwards in order to do that. I know that many people have asked us about why Sacramento, and also when you look at our region, I think all the counties surrounding us are kind of in the same situation, why we are lagging behind. And there, as I've mentioned before, there are multiple factors that are contributing to that. Some of that is due to the testing volume. We know that the number of people that are seeking testing has dropped a bit. And so that could be contributing to why we are lagging behind. The other also that we are monitoring is variants. We know that there are several reports that we have received of variants within Sacramento region, and that could be contributing to the stagnation in cases. And Jamie will talk a little bit more about it. And then the other factor is that vaccination rates. When you look especially at counties that have a higher percentage of people in the healthier or more well-to-do quartile, you find that they are doing a lot better than some counties that have more in the what we call the health equity quartile. We are working really hard to be able to increase our vaccination rates in the health equity quartile. And we did provide our Board of Supervisors with a map yesterday of what the vaccination rates look like by zip code and which areas we are focusing on. So with that, I will turn it over to Jamie. I know that last week there were a number of questions that were epi related, so she is going to provide an update.
Thanks, Dr. K. So I'm going to talk a little bit about the variants, missed second doses, and breakthrough cases. So we received a batched list of 306 specimens that were new variants from the state lab on Monday. Our EPI team did add those to our lab dashboard on Tuesday. However, it's important to note that the specimen collection date for this batch ranged from December 17th, 2020 to April 3rd, 2021. So these are not all new cases. They were just batched in the PCR testing at the state level, and we received them all at once. We expect to see a higher percentage of West Coast variants locally compared to what's circulating nationally since those variants originated here. The West Coast variants, including B.1.429 and B.1.427, make up the majority of the variants that we are seeing circulate locally, followed by the UK variant B.1.1.7. CDC classifies SARS-CoV-2 variants of interest as variants of interest, variants of concern, and variants of high consequence. The UK and the West Coast variants that we're seeing here primarily fall under the variants of concern classification. So a variant of concern is one for which there's some evidence of increase in transmissibility, more severe disease, less immunity, whether that's through convalescence of actually having gotten the disease and having antibodies, or through vaccination, or more evidence of diagnostic failure and or treatment effectiveness. For the West Coast variants in particular, there's some evidence of about 20% increase in transmissibility for that particular variant. To date, the state has not notified us of any variants circulating locally that are considered high consequence. A variant of high consequence has clear evidence that prevention measures or medical countermeasures have significantly reduced effectiveness relative to previously circulating variants. So that's good news so far. In terms of missed second doses, locally, we actually only have 3% of people who've had at least one dose of a 2-dose series who are considered to be missed second doses. That's higher for Moderna than it is for Pfizer. It's about 6% with Pfizer and 0.2% for Pfizer cases. We previously sent out some data that broke out the timeliness of second doses compared to first doses that looked at those who had already completed the series, whether it was on time, delayed, or outside the recommended 6-week window. And we had separated those out from the timeline for those who have so far only received one dose. If you look at those percentages, those do not represent what is considered a missed dose. So I sent Jana the table updating those numbers as well as our actual missed dose numbers that she will be sending out following this call. In terms of breakthrough cases, those are also now on our dashboard. In Sacramento County, we've had a total of 152 persons with a positive PCR result after full vaccination. Of those, 29 were symptomatic. And the Council of State and Territorial Epidemiologists has now come out with a national case definition for breakthrough cases. And nationally, they are only counting those who are symptomatic. And previously, when we have provided those numbers, we've looked at any PCR positive regardless of symptoms. And so out of transparency, we will continue to post both of those numbers, both the asymptomatic and symptomatic cases on our dashboard. And I'm going to turn it over to Mike to talk about some of our community sites.
Yes, good morning, everyone. Hi, I'm Mike Way with Sacramento County Public Health. As Dr. Kasiri mentioned, we continue our community clinics and vaccine efforts to really ensure the health equity quartile zip codes are locations and areas that we put in a lot of these resources. So this means that we are continuing to partner with our different partners, including health systems, schools, community-based organizations, CBOs, and other agencies and entities to really ensure that there's equitable distribution of vaccine resources, particularly in those areas. How we're, as you may heard, there has been a decrease or a drop in demand at some of the clinics. How we've been addressing that is continuing to work with a lot of our CBOs and community-based organizations and different partners to really increase communication efforts, addressing any misinformation, addressing disinformation and vaccine hesitancy. It looks really different for each community. And we're really leveraging the trusted messengers to disseminate a lot of that information. So now we're expanding our efforts and continuing to work with youth and faith-based organizations, Catholic churches and mosques and other religious sites to help spread the word. In addition to that, working with our CBOs to create and disseminate some of that information. And those are the updates I have.
Hi, I'll go ahead and update you on our allocation this week. We received, or for next week, we will receive 31,660 doses of COVID vaccine for Sacramento County Public Health and our partners. That's 21,060 doses of Pfizer, 8,900 doses of Moderna, and 1,700 doses of Johnson & Johnson. I think that's our biggest allocation to date. And then I wanted to take a moment just to point out that last Friday, our dashboard showed a milestone that we're very proud of, that we have reached 1 million doses of COVID vaccine administered in Sacramento County. So it's just a moment, I think, for us to reflect. We are aware and acknowledge how much hard work has gone into reaching that number. And we really could not do it without the network of providers here in Sacramento County and just a fantastic relationship with them. It's our health system and hospital partners, provider offices of all sorts of offices, pediatric to adult providers, the clinic systems that we work with, and also pharmacies, both independent and chain pharmacies. have all just really risen to the challenge and come forward and just been willing to partner and work really, really diligently and hard on this effort. And also very thankful for community-based organizations that are helping us to connect to the people that we really are trying to reach. And I want to acknowledge the people that have assisted us in our volunteer workforce as well. So Sacramento Medical Reserve Corps has been with us since the beginning of the pandemic, tirelessly day in and day out, volunteering both for testing and also now at our vaccine sites. And also we've had the National Guard on, many who've been on mission here in Sacramento for over a year now, both with testing and now they've converted that mission to vaccination. So really grateful for all of them, and we could not do this without them, but also most importantly, just acknowledging that that's 1 million doses that went into people in our community. So thankful for those who've been willing to do their part to help us to end this pandemic. So also we acknowledge there's a lot more work to be done. So our sleeves are still rolled up and we're ready to continue digging deeper and making sure that we offer vaccine, as Mike said, getting out into the neighborhoods and communities that are really need better access. And so just continue to work on that. And I'll turn it back over to Jana.
Thank you, guys. So good to hear about amazing milestones. I continue to be amazed every day at the dedication of this team that you guys have the opportunity to chat with every Thursday. Okay, so we will go ahead and open it up to questions. As usual, Alex, you can go first because you jumped in on the chat, and everybody else, if you could utilize the raise your hand feature or the chat feature, and I will call you guys in order of first come, first serve. So Alex, go ahead.
Hi, Alex from the Sacramento Bee. I wanted to ask about those lower vaccination rates in certain zip codes. Based on the mapping data, it appears that it's largely lower income neighborhoods that are seeing that lower rate of vaccination. I'm wondering, has the public health department gotten a sense of why vaccination rates remain low there? Is it an access issue? Is it a outreach issue? At this point, you know, you have all those clinics, but I don't know if it's sufficient right now. So thank you.
Yeah.
I'll start off. I think it's a combination. Part of it is, yes, an access issue, because when we started, especially with limited vaccine, we did focus a lot on our larger throughput sites. And then as we started getting more vaccine, we were able to start the pop-up sites. But we are also cognizant of the fact that there are a certain level of vaccine hesitancy. And that's why it's really important for us to work with our community-based agency partners in being able to address some of that. And Mike, if you'd like to add to that.
Yeah, and I think there's a lot of compounding factors. I don't think there's like one answer, or else we would not be in this position, right? As Dr. K mentioned, vaccine hesitancy and misinformation and other historical processes have been in place that just got further exacerbated during this pandemic. So I think, as that sounds like a broken record, as Dr. Kasiri mentioned, this is why taking the approach of a multi-pronged approach of utilizing the trusted messengers to mitigate as many of the access barriers or the transportation or other barriers to really build up that vaccine confidence among the disproportionately impacted and underserved communities is really critical.
Okay, Michael from SACB.
Hi, this is Mike from SACB. I had a couple questions related to the breakthrough case numbers. First, are those numbers about in line with what was expected? Are they better? Are they worse than what the county could have kind of anticipated based on the clinical data? And my second question is, out of those 29 that were symptomatic, could you tell me if there were any hospitalizations or deaths in that group? Thanks.
So in terms of your first case, I can come back with a specific comparison to what's happening nationally. I don't know those numbers off the top of my head, but I would say that 29 out of over 100,000 cases is very few. And if we've given, like we mentioned before, over 1 million doses have been given out. So it's very, very small percentage of people who are getting vaccines who are becoming infected with COVID from the surveillance data. So I would like to say that that is about or less, even less than what we would expect. And again, I can come back with some specific comparisons. I don't know the answer to the second question, but I can look into that. We can dig up and see if any of those 29 cases are hospitalized or deaths. To my knowledge, none of them are, but I will confirm.
Chris Hooks.
I have two questions, both of which are sort of follow-ups to Alex's. One, is there an update on the 2 stationary sites in 95823? And then 2, to the 3% of missed second doses, is there any data about who those people are that are missing those?
So with the missed second doses, again, we haven't dug much into that in terms of demographics. You mean, like in terms of or where they live?
Yeah.
We can run those data and get back to you.
Okay.
You just start making a list. Janelle, you remind me if
Yeah,
that'd be okay. Perfect. So yeah, we'll run some numbers for you, Chris, and get back to you on what that looks like demographically in terms of the total population. And then in terms of the 2 sites, we're still moving forward. It's definitely moving slower than we thought. I take full responsibility for that myself. We are pursuing kind of 2 different county processes. One is an exception to bid, but we're also going to the Board of Supervisors with authority to be able to enter into these types of agreements. And so hopefully one of those will come online soon. That said, we are seeing a decreased appetite for these mass vaccination sites. We do have the Pinnell Center, which has a really incredible throughput through our partner, Dr. Ishida. And that has kind of become a regular mass vaccination site there. And so these 2 sites, once they're set up, they'll probably look a little different than like a Cal Expo, where it's either like a 5 or 7 day a week thing. They'll probably be targeted populations or communities or family events at these locations. So, you know, the needs of the community have shifted since we started looking for those sites.
okay, I do not currently have any hands raised or anyone in the chat. Are there any additional questions before we wrap up for the day? Oh, Alex, go ahead.
Sorry, I was muted. I had just a quick clarification about the data regarding partially vaccinated and fully vaccinated residents in Sacramento County. So in the graphs that you've shared with the Board of Supervisors, excuse me, the maps, you've separated out like at least partially vaccinated and the fully vaccinated. And I wanted to know if people who are fully vaccinated are also double counted into the at least partially vaccinated category. Is that question?
I can answer that. So yeah,
okay.
At least partially means they've had at least 1 dose. So it would include both those with 1 dose and 2 doses.
Okay.
So yeah, so the fully vaccinated would just be the ones who've either had 1 dose of J&J or the full series of a 2 dose.
Great. Okay. Thank you. Well, I guess, sorry, one last thing. So it's not on the maps that you've shared with the Board of Supervisors, but I'm wondering if you could share where you're seeing at this point, are there any places that have reached like 70 or 80% vaccination fully? Like, are there any zip codes in particular that have reached that?
We can look at that, but I believe that the highest that we have seen is in the 60s. But definitely we can look more specifically at that. And those, the darker shaded area zip codes on the maps that we showed are the ones that would most likely have those high vaccination rates.
Awesome. Thank you.
Follow-up question from Michael.
Yeah, I just wanted to ask or get another update on sort of I know last week Dr. Kassier said it looks like we'll be in the red tier for most of this month, probably at a minimum. And so I was wondering first, is there any concern that as we get closer to that mid-June sort of deadline the governor has set for having businesses reopen, that businesses or activities might start to open a couple weeks early, as people just sort of say, oh, it's only 2 weeks until that, why follow the guidelines? And secondly, well, I forgot what my second one was, but that was the main one.
Mhm.
I'll just add to that. We had another question from the Observer that says, what happens if Sacramento doesn't meet the June 15 deadline? So I think those two questions are similar for whoever's going to answer that.
Yes, so when we get to June 15th, if at the state level, we meet the criteria that the governor set where vaccines are readily available to everybody, and also that the hospitalizations remain low and steady, that the blueprint will be retired. And that means that our health officer order will end as well, both at the state and the county level. As going back to the question that Michael asked, I think that the businesses are willing to be patient. They have been patient thus far, and we really appreciate all of those that have been doing their part to follow the guidance that we have put out and make sure that we reduce transmission within the community as much as possible. I am not concerned about any businesses trying to jump ahead before June 15th. I think everybody is going to be able to wait for that. They've waited this long, and we continue to work with them on a regular basis. And of course, the question they're asking most of the time is, what do we need to do past June 15th? And we are getting additional information from the state on that. We know for sure that at least at the beginning, we will still have the masking mandate. And we will also see if there are additional guidance that will be provided, especially for large gatherings. So we will provide that as soon as we get it.
And then just a quick update, Jamie did throw in the chat that she confirmed that no single zip code has reached that 70% vaccination rate. Okay, I don't see any more questions. So just as a reminder, I will send out this recording fully within the hour. And then we have requests for follow-up data on missed dose if we have any demographic data, either geographically or the makeup of those people groups. We have a request for the 29 people that were symptomatic for breakthrough cases, if there are any hospitalizations or deaths. And then I will send out, in addition to the full recording, I will send out the allocation numbers, the vaccination rate map that we showed at the board meeting on Tuesday. The breakthrough cases are on the dashboard, but I will include those numbers as well. I will send out a missed second dose table with the most current data, and then a link to the dashboard, and as well as our community pop-up clinic page where people can make appointments. So thank you guys for joining us for the May 6th Sacramento County Public Health briefing, and we will see you next week.